This lecture on the spleen and the lymph nodes will be fairly short and sweet, which I'm sure all of you might appreciate after some of those longer lectures. We're going to cover the spleen, the splenic hilum, which is the entrance and the exit for the splenic artery and vein. We've covered the artery and vein fairly extensively in some of the other lectures, so we will just go over those briefly. And then we will also cover the lymph nodes, a few of the major groups of lymph nodes and how they course along the anatomy, different organs, and the vessels that feed those organs. The spleen sits in the left upper quadrant of the patient, and it is highly vascular. And the liver is also highly vascular, but what you might notice in scanning patients is that in the liver you can see bits of the vessels as they course through the liver, but in the spleen it looks fairly homogeneous. So that's a little bit of a difference in those two organs. This spleen image actually has a little cyst on it, so that's a slight abnormality. And the splenic artery and vein, the artery feeds the spleen and the vein drains the spleen. And as you might recall, the splenic artery, which we see just a little piece of it here, sits along the superior border of the pancreas and tends to be a little bit windy as it goes from the aorta to the spleen, whereas the splenic vein is a little straighter and courses along the posterior edge of the body of the pancreas. And the spleen is also protected by the 9th through the 11th ribs, so you can see portions of the ribs here as they come across and protect the spleen. This is a CT image, as you know, because the bone is white. We've got the liver here on the left side of the screen and the right side of the patient. This is the left lobe of the liver and the right lobe of the liver. We've got the portal vein, and remember the portal vein sits anterior to the caudate lobe of the liver, and the caudate lobe of the liver sits anterior to the IVC. So portal vein, caudate lobe, IVC. It looks like the the right adrenal is here, just posterior to the IVC, and then you're coming into the superior pole of the left kidney here on the left side of the patient. In this image on the right from Netters, you can see how the splenic artery feeds the spleen and the splenic vein drains the spleen. The spleen sitting up here in the upper left-hand quadrant, and the stomach has been cut away. You can see the left kidney as well. And the pancreas, the pancreatic tail, sits in the hilum of the spleen. And remember, the pancreatic tail is the most posterior and superior portion of the pancreas. In this particular image, it appears as if the splenic artery and vein are about the same thickness and that they both course fairly straight, but in general, the splenic artery sits a little bit more on the superior side of the pancreas and is a little more windy as it goes towards the spleen, and the splenic vein is on the posterior side of the pancreas and courses more of a straight line as it goes towards the IVC. On this image here on the left, you can see the spleen here on the left of the patient and the liver on the right. This is the vertebral body, and you can see the aorta and the celiac trunk coming off of the aorta. We see just a little piece of the splenic artery and a bit of the splenic vein here as well. In this drawing, we get a really good view of the splenic artery and vein. The spleen sits in the upper left-hand quadrant of the patient, and you can see the pancreas here and how the tail also sits in the hilum of the spleen. And because you can see through the pancreas, you can see the splenic vein as it courses across posterior to the body of the pancreas. They've neglected to draw the inferior mesenteric vein, but you can follow the splenic vein as it meets up with the superior mesenteric vein at the portal confluence and becomes a portal vein. And then coming off the aorta here is the celiac axis, and the splenic artery courses superior along the border of the pancreas. Let's take a look at the nodes now, and probably the three most important things to know about nodes is they are just about everywhere in the body. They tend to follow the organs and the vascular that support the organs, and as you've probably begun to notice, is that most of the vasculature, the vessels, are named for the organs that they support and feed or drain. And the other thing about nodes is that they generally do not enhance. It is not normal for a node to enhance. They will sometimes get inflamed, they will get swollen, and that's how you can tell that there's something wrong with them, but they generally do not enhance. So you can see here in this image from Netter's 5th edition, plate 259, how the nodes follow the vessels, and they are just about everywhere here along the vessels, the major vessels of the body as they go down. And then if you take a look at this little image that I pulled up from Google Images, you can see where some of those major groups of nodes are, lymph nodes, under the armpits, along the neck and the head, down in the central area of the body, and then in the pelvis. Oh, sorry about that. They even, extend down into the legs and into the arms. So the nodes will cover the entirety of our bodies. I really like this image from Netter's because it shows you how pervasive the nodes are throughout the intestines. There are so many of them in here that help to support the intestinal tract. And the smaller groups of nodes tend to feed into the larger clusters of nodes. And you can see that there's a list here of some of the general bundles, but there are more than just these. So I just wanted to list a few of them for you here. We will not ever have to identify groups of bundles or name them all because there are so many throughout the body. Once again, they generally do not enhance with IV contrast, so they can be difficult to distinguish between those and the small vessels. Sometimes when you're distinguishing those between those and maybe a small abscess, the abscess again will have a ring enhancement, and the pus inside or the fluid inside will not tend to enhance. And as I mentioned before, the nodes are identified more easily when they are enlarged, because when they are enlarged then you can see them and you can tell that they're not a vessel or a abscess because they don't enhance. So that is the spleen and the nodes, and that will wrap up this lecture for this time.